Hello to all my Support Fibro friends. I do hope you can hear me. I'm using some news. I'm just streaming live directly through YouTube. I just wanted to say hello because we had people asking questions about when our next live stream is. So hopefully it'll be coming up more soon and prepared. We just got back from a lot of traveling. So 20 days on the road. Next time we're going to be doing better at doing more lives continuously for all of you. It's been quite an adventure, a lot going on. So we did some meetups with our Support Fibro friends. We actually did attend the Brain Initiative. So that was really cool through the NIH, meeting with researchers on brain. We participated in the Patients Rising Now Hill Day, which was fantastic. We coordinated with other chronic illness communities around Capitol Hill to help advocate for different chronic illness policies in healthcare, improving healthcare overall. And I'm going to have more information all about that once I wrap up. I have to admit, I am tired and I'm trying to get caught up with everything. Lots of emails, lots of stuff to get caught up with. So I appreciate it. If you are following us on Facebook and Instagram, you'll see more of the picture updates. So I wanted to be sure to say hello to all our friends here on YouTube and let you know we're continuing to produce content. We do need to get much better and more proficient at video content. But if you do follow our other accounts, we have been posting photos from the road. So good reminder here to keep the YouTube page updated. So shout out to our friend Robert. No, we are still very, very active behind the scenes. I just personally have been traveling for over 20 days. And then Brandy joined me out there on the East Coast, and we got to meet Danielle and a lot of great and cool Fibro warriors. So that was part of it. And then I just wanted to share with all of you, I did then after DC, I flew directly into San Diego for a health coaching conference. And I wanted to just share with everyone, I did get the Servant Heart Award at the San Diego conference, which was very fun and quite an honor. Talk about imposter syndrome in some sense, because I was on the stage with people that write my textbooks in health coaching and people who are definitely trailblazers in the health coaching profession. It's pretty incredible to be on the stage with all of them there representing the fibromyalgia community. So some of you may or may not know that I do work as a board certified functional medicine health coach, doing group medical visits, which is very, very cool. And we always share more information. We're trying to get more providers to create more group medical visits for fibromyalgia specifically, or fibromyalgia and chronic pain. So I've been fortunate enough to learn this side of the healthcare system and want to expand and bring that to other providers. So what that looks like for me in working situation is I get paired up with providers across the country. Now I work with various chronic illness conditions, but of course I lead the groups for chronic pain and brain health. So I work with a lot of neurodegenerative diseases and patients living with that along with their caregivers. And the group medical visit, since I'm paired up with a provider as the board certified health coach, it is billable through insurance. It's not an exact science, but it's exciting to know that we can bring health coaching and making it more accessible and affordable to everyone to utilize these lifestyle modifiable tools that I bring to everybody to improve the quality of life for all the patients. So at that work, I'm juggling tasks. I do one-to-one coaching. We have exciting news for Support Fibro. We are going to be launching more group visits here, and it'll be on a scholarship-based program. So we'll be offering scholarships for those of you that would like to participate. We would love for people to be committed to these groups, because I definitely continue to do it more of as a pilot study and submit abstracts for research. So we want people to be able to enjoy this part of it as well and lead it in a group session. But in the meantime, while we launch those in the fall, I'm excited to share, of course, Dr. Ron at the Texas Center for Lifestyle Medicine and his team, they do have group programs available, which are billable to insurance. So if you are a resident of Texas, please, I encourage you to really sign up for these groups. And get the value out of the community. You are not alone in this. And then also the benefit of not only having Dr. Ron in the groups, who is he's super knowledgeable. He knows a lot of things. He is embracing the fibromyalgia community, but he's also bringing in guest experts to speak to the patients that are in the group. And again, they do utilize insurance at their clinic, which is fantastic because you get the benefits of functional and integrative medicine. So Dr. Ron is a trained MD, and he has other MDs leading various groups. He brings in a registered dietitian, mind body coach, health coach. So lots of professions coming together for the group visits that he offers at Texas Center for Lifestyle Medicine. He opened up a fibromyalgia and chronic pain group, dysautonomia group. There's an autoimmune group. There's a kitchen lifestyle group, which happens Tuesdays. And then, of course, his brain health group, which is on Thursdays, which you enjoy. And if you are in person and close by to the clinic, they do have some in-person sessions as well. So I can't encourage you enough. If you do live in Texas, please utilize their clinic to improve your quality of life and learn as much as you can. You can use it as an adjunct, of course, to your primary care physician. So if you see a primary care physician, you can still join the Texas Center for Lifestyle Medicine because majority of the programs are all virtual, and you can add it into your care plan that you're already doing. Or if you do see a rheumatologist by chance, I know those are few and far between, you can still go to the Texas Center for Lifestyle Medicine. Just ask them questions based on the insurance that you have, and hopefully you can get in, crossing fingers. There are other groups that we have programs with that we're working on with another coach as well. She has a tremendous nutrition background. So she wants to actually do nutrition centered types of groups that more workshop based, but she is a phenomenal coach. So the fact that she called and said fibromyalgia is really huge and exciting news. So there's a lot coming down the pipeline for everything that we're doing. And again, just making adjustments. We'll be back on the road. Hopefully we'll see Randy for a little bit of time, but I will definitely be back on the road. I'm planning it right now. I did not get a lot of sleep because when I start planning road trips, I start thinking about maps. So I'm excited to see what that looks like right now. My big idea was for me to take the train across the country. It's not manifesting in the way that I would like it to. So it's probably going to be a combination of planes, trains, and automobiles. So I'll be driving, I'll be doing on the trains as well to different cities. So stay tuned for that because they definitely are. There's ones that I have to figure out perfectly, but I know we'll be back in Bethesda at the end of July. So from there, Bethesda, Maryland, if you're out in that area, please come and meet for a fibro meeting with us. And then I'm putting together different dates for different cities. So Cleveland, Ohio is on the list. Syracuse, New York, we're trying to make it happen. I know there's going to be stops along the way. Omaha, but definitely have that in the calendar. Portland is in the calendar. And then it doesn't stop there because later in the fall, we'll be doing some more dates as I go back through the South. So there is a conference definitely looking to happen in person in Houston. We'll get you those dates as well when it comes up. So from Houston, obviously, I will plan ahead and take the train through the South. So hopefully I'll get to see some of my good friends in Mississippi, go through the Carolinas, make it through. So we'll be visiting South Carolina, North Carolina. I know I miss all of you. You're on the list. And then, of course, California, Northern California friends, you're always on my list. And I have been delinquent in making my trip up there. I'm in Southern California, so we got to make that happen. Of course, anytime people are in San Diego, let me know because that is a wonderful drive. And you never have to twist my arm to be going to San Diego at all. So I would love to connect with you. So many different places, so many different people to connect with. So please stay posted. I know I'm doing this live stream and hopefully everyone can hear me. I'm doing it directly through YouTube, which is fun and exciting, but we will have more updates shortly. There's a lot that we're doing and transferring. We are transferring the website to a potentially a different portal, and we're going to have a lot of education models in that portal. So this is stuff that you can log into, get video content, grab some education besides what we put up on the social media channels. So be directed as we start to develop more of the group health coaching programs for you. So we want to create that. There'll be an advocacy training portal. So that's what we're doing behind the scenes. Please join the Inspire Health Network if you are looking also for a different experience for your online community. You can join Inspire anonymously. You don't have to have your credentials or your name and all the stigmas that kind of go around social media. So please take a moment, if you haven't done, to join that network. Give us feedback. We're building up engagement, and we're also working on an Ask the Expert series, which we definitely launch with our good friends from Inspire. So there's some good things coming around. I know I'm going to be pretty busy, just to let everybody know. I'm probably going to be doing separate videos on a different channel on my process of going back to school. I'm very serious about that. I have to take my core science requirements. I do have a bachelor's degree in biology, and I've done a lot of clinical and advanced training in neuroscience and functional nutrition, but I got to take some of my core science requirements. So I'm going to be using another YouTube channel for that. But just to let you know, if anyone out there is currently doing the same thing, I would love to talk to you. Or if you're considering going back to school, no matter what the age is, definitely reach out, because I need maybe some accountability as we go through this, because it can be a little bit defeating at certain points of time as you're trying to get back into the school routine. And I'm definitely looking at clinical track, so I will have to go back in person, which is going to be a challenge for sure as a chronic illness patient, and intimidating from what I used to go through going back to college. But just wanted to give everybody an update. Please definitely follow all our social media accounts so you can stay updated. And we will be back very soon with more regular programming on all our channels, especially with our live broadcasts and video content. Thank you so much, everyone. My name is Melissa Tolwer. I'm the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach. I will talk to you soon. Bye.